We are now going to review two key terms that you will see in older adult public policy. The first is standard of care. And I'm sure we've all heard this at some point, either through our observations or our own medical experiences. There is no medical definition of standard of care. This term is commonly used in medical situations to refer to a diagnostic or a treatment process that a prudent healthcare provider ought to follow for a certain type of patient, illness, or clinical circumstance, or in legal terms, the degree of care that a reasonable person should exercise. Thus, a standard of care is the acceptable and appropriate care that an occupational therapist provides for a client's condition. Occupational therapists apply standard of care in practice by utilizing as much as possible evidence-based practice with intervention approaches and by having practice guided by the AOTA's occupational therapy practice framework. In the United States, standard of care may be outlined by state licensure boards by which the professional is admitted to practice. For example, to maintain a license in Pennsylvania, occupational therapists must adhere to ethical principles and standards of professional conduct outlined in the state regulations in that specific state. These regulations require that the must maintain confidentiality of client information, respect the legal rights of the client, and perform only those functions for which the therapist is trained and competent. It is so crucial. I know you learned this in your lead class, but it is so important to know what is required within your specific state. The ones that were listed here for Pennsylvania are pretty standard across all states. However, there may be things that your state requires from an occupational therapist that another state does not. And if you are licensed in that state and practicing in that state, it is crucial that you know that. Informed consent is the respect for a client's autonomy by allowing the client to be the master of their own course of intervention and provides control in what the client may experience as an upsetting or out of control situation. Healthcare practitioners must consider the client's health literacy and cognitive level. All healthcare professionals have the ethical and legal obligation of obtaining informed consent from their clients, whether in a medical or a community setting. So now OTs are really practicing in a lot of what we would call non-traditional community settings. It still maintains that clients have the right to provide informed consent for what they are going to be experiencing in therapy. As stated in Principle 3 of the AOTA Occupational Therapy Code of Ethics, persons have the right to make a determination regarding care decisions that directly affect their lives. In the event that a person lacks decision-making capacity, their autonomy should be respected through involvement of an authorized agent or surrogate decision maker. Health literacy is the ability of the client to comprehend information provided about a specific medical procedure, condition, or intervention. Advanced age has been found to be one of the factors most highly correlated with low health literacy. To ensure that older adults are empowered to truly make informed decisions about their course of intervention and therapy goals, occupational therapists must either informally assess the client's health literacy level through a thoroughly reviewed client history, chart review, or an interview by consulting other professionals on the care team, such as the SLP or the social worker. Client education should be tailored to that specific client's needs.